and welcome you. Hello, I'm Janet Gillow. I'm the Director of Professional Development for the Brown School. I'm also a very proud 1995 alum of our MSW program. And welcome to Open Classroom. This is our fourth offering, and this is a program that we created. It actually started in response to just a couple of requests to our dean's office. Some agencies who the staff was working from home, couldn't do their standard work, wanted to use this moment for some constructive professional development, asking the Brown School, what could we do? And we are humbled by the work that's going on in the field right now. We're eager to be of service and to provide that connection. So we threw together a series of 10 webinars, some of which the names have changed since that first moment, but in response to the community need. And we did not know what we were creating and how many people would respond to it, but we've been just so pleased, a little bit flabbergasted, as we've now had more than 1,300 people indicate an interest in joining us. So welcome. You're part of an extremely special group, as the Brown School has always been. And as I've thought about kind of what's bringing people together at this time, I thought about how the Brown School has always been a place where talented people come together to share information and ideas. When I was a student, the Brown Lounge was where it was at. We had one building, and that was our social space. And then, in the early 2000s, with the construction of Goldfarb Hall, the Goldfarb Commons was where students convened and shared ideas and interacted with faculty. Since 2015, we've been so blessed to have Hillman Hall, and now it's the Forum and the new Grounds for Change where we come together. And in this moment, Open Classroom is where we're gathering. I hope it is just for a moment, but I'm so grateful that you're here and participating in this community. And today we've got a wonderful talk from just absolutely one of my favorite colleagues. The revised title is Implications of COVID-19 for Protecting Children and Supporting Families, the Current Realities and Future Impacts, delivered by Dr. Melissa Jonson-Reid. Dr. Jonson-Reid is the Ralph and Muriel Pumphrey Professor of Social Work and also the Director of the Center for Innovation in Child Maltreatment Policy, Research, and Training. She has practice experience in both domestic violence counseling and program administration of the schools-based program for supporting kids in foster care. She currently provides evaluation consultation for state and community organizations. She also partners with community agencies to explore outcomes of interventions and design to support young families as well as youth involved in child welfare. So I'm delighted to welcome, and I think you're in for a treat, my friend, my neighbor, colleague, mom to 2 wonderful boys, 3 wonderful dogs, including Waffles the puppy, Dr. Melissa Jonson-Reid. And Melissa, take it away.
So thank you so much. I just want to say I appreciate you taking the time. I'm usually a mobile talker and making connections with eye contact and all those things, but I want you to know that thinking of you and all the things that you're doing for children and families, and just want to give you all a shout out and thank you for sharing this time. The reason why I changed the talk actually is I started thinking about our current context in which we're all sitting here in front of the cameras and the things that are going on in child maltreatment and child welfare, and decided really to kind of shift the focus to
Melissa,
yeah.
We're getting some feedback that the audio isn't great for people. If you have any ability to get closer to a microphone, let's try that.
Okay, how's this? Is this better?
Much better, I think.
Okay.
Thank you.
Okay, so as I was saying, I just really want to give a shout out to all of you who are in the field, even if you're raising things from home and you're maybe raising kids and you may be taking care of parents. Just want to say that I appreciate everything that you're doing before we get started. So today I'm going to talk a little bit about the current context for COVID-19, its impact on child abuse reporting, what we're seeing, discuss a little bit about our effect on response to reports, some changes that are happening due to remote case management, and then end with looking ahead to post-COVID child protection and child welfare practice. I'm going to allow for breaks for questions, and I know Janet's this awesomely capable chat monitor that's going to help me with that. And I also have a lot of embedded resources in these slides. I am not going to talk about those, but I am going to make the slides available on our center website afterwards, so that you can then access all those links at your leisure. We're trying to keep the barking down. If you do hear barking in the background, you can say hi to Waffles, and her two older friends. Okay, so I'm not going to belabor this, but there are a lot of reasons to believe that this current crisis will make things worse for children and families. This is not only based on prior research, but we're very concerned about the impact of increases in economic as well as mental health stress, but also what we're already seeing in terms of helpline calls for material needs, foods, increases in parents calling national parent helplines, increases in calls for domestic violence assistance. So there's a lot of reason to believe that we should be concerned about our children and how our families are doing. On the other hand, this sort of stands in stark contrast to things that we're seeing as headlines in the news right now. Reporting child abuse, the numbers are disturbing, concerns about child abuse and social isolation. So what's happening? Well, in a time where we would expect risk to go up, what we're actually seeing in reports across states, across the country, are some fairly dramatic drops in child abuse reporting, generally between a third and 70%, just within the last month. I'm going to call out Florida and Texas a bit. For those of you who are really good at visual memory, you can hang on to those thoughts for a second, and you notice that they're a little bit different than the others. So a lot of people are talking about this drop being somewhat like maybe what we would expect in summer because of schools closing. So I want to actually bring some data to this and say, is this really what's going on, and what is this? So there is a national child maltreatment report that comes out every year. Underneath that is a bunch of data that can actually be merged longitudinally. We've had the opportunity to do that at the center, and ran some analysis for today just to look at what that dip in summer looks like. So it does exist. These are data combined from 2015 to 2016, looking at monthly reports of child maltreatment. So actual numbers, and then the numbers across the bottom, one is January, 12 is December, and looking at where they come from. So if you look at this, you'll see this dip. Pink is overall reports. You'll see that dip in June and July. And that black line towards the bottom, those are the reports from educators. So you do indeed see a dip. The problem is this dip in reality is only about 17%. So when we do a little math that we're not showing between both what we can see on the screen and the percentage of reports that are made by educators, it simply can't be true that the 30 and 70% declines are from school closures. So I told you to hold on to those Florida and Texas numbers. They look a lot more in tune with that 17% dip, but there's a reason for that. That those articles that reported that were reporting case drops before the schools closed in those states. So what that means is that we're actually lacking reports from multiple sources across the country right now. This is interesting in addition because what's been happening over recent years is actually more mandated reporters are making reports. So that red line is neighbors, friends, family. Okay, and you can see that stays pretty straight across this line. So about the same number of people in the community are making reports as they always have. But in recent years, the number of reports coming in from mandated reporters, professionals, law enforcement, educators, medical personnel, school personnel, etc., have been going up. So this is actually a concern in two ways. We're seeing this dip in a time when we see even more reports coming in from mandated Now let's play devil's advocate. Should we be worried? In a recent article, a reform advocate was quoted as saying, oh, maybe we shouldn't be worried since many reports go uninvestigated anyway. How do we think about it? Well, first,
I'm sorry to interrupt. The audio is still cutting in and cutting out.
okay.
I don't know if there's anything that you can do, but I'm just giving that feedback in case there is.
Okay. Is this better again? I'll try not to move.
It's so hard, especially if the microphone is not your friend, but thank you for what you can do.
Sure. So as I mentioned, some people have called into question whether we should be worried about this trend because so many reports go uninvestigated. And first, I want to say this statement is not universally true. A lot of variation from states like Missouri that investigate or assess most of the reports accepted to those states like South Dakota that screen out most. And second, studies indicate that calls for mandated reporters are more likely to get a response. In other words, they're more likely to be screened in. This means that a dramatic reduction in mandated reporting is much more likely to include those reports that we would have responded to, not those reports that we might have screened out or ignored. What this means in terms of the future is that what we can't prevent during this time, in terms of supporting families, we will likely see later in terms of a surge in reports. So the typical summer dip, as I mentioned, it's only about a 17% drop. Imagine rebounding from a 70% drop. Many people believe that when social distancing ends and children have more contact with reporters, we will see a very large wave of new concerns reported across the country. The audio better? So take home number one, it's really imperative we do everything we can to be aware of the well-being of our children in our communities. Social distancing doesn't mean preventing phone calls or emails to neighbor and family, helping with groceries for those who can't get out, providing clear messages to families about where to get resources for parenting and meeting basic needs, and also how to access them. I know all of you know that, but I just need to emphasize the fact that we need to normalize asking for help and be ready to provide it. So here's our first embedded slide full of resources that I'm not going to read, but are going to be available to you on our website. A slide full of child protection, reporting, and material needs, and then a second one for supportive parents. Okay, so that ends my first little segment. Are there particular questions before we move into the next?
So again, for those of you joining us on the Zoom, please use your chat to share any questions that you have about the content so far. Mostly what we've gotten are just some warm greetings, former students of yours saying how exciting it is to see you again. So I think let's keep moving.
Okay. Okay, so our second segment is to think a little bit about what is happening when families are reported right now and have contact with child welfare. This isn't hitting the news quite as hard, but it is coming out in agency memorandum and a few anecdotal reports in some of the articles across the country. So responding to reports, very rapidly this changed when we went to social distancing. Guidance from states published so far more or less follow this. Calls should be made to the family first. So normally if I were a child abuse and neglect investigator or an assessment worker, I would go to the home or to an agency and I would talk directly to the family and the child about concerns. Because of the COVID-19, many agencies are now recommending a phone call first. Then those staff are to ask families a set of questions about exposure to COVID. If responses are negative, investigations and assessments go on as normal. If responses are positive, workers are to contact law enforcement or EMS. That depends on the state. In some cases, workers have noted this, at least in part, because no one has ever considered the need for CPS investigators to have protective gear. In other states, agencies are attempting to find alternative locations to meet, like parks or in the front yard. The other thing we have to remember is that these guidelines were issued as the crisis unfolded. This means it was not possible to provide training, and we'll talk about that a little more at the close of the talk. So is this all that important? Well, research indicates that while a CPS report may well be jarring, families actually appreciate the support when services and resources are given. Now, those resources are different. It is really critical that we help our child welfare agencies across the country rapidly retool any of those resource guides they have, or we run the risk of recommending services that either don't exist or are too difficult to access. The stress and concerns with the COVID context for investigation may also increase the already very high turnover rate in these positions. This is a concern that we'll bring up again later. Adherence to risk assessment protocols may well be uneven as people struggle to work remotely and then respond to calls. And we have to remember that our CPS staff largely are also doing investigations or working from home. I bring this up because families, no matter the vulnerabilities, are also undergoing a series of stressors. There was a recent article, came out about 3 days ago, that makes this point from the vantage of a privileged two parents to share the load, good income household. And she says the current situation is almost prophetically designed to showcase the farce of our societal approach to separating work and family lives. We are expected to work from home full time, care for our children full time. We cannot have anyone outside our immediate household help. It can't work. So and keep in mind that as we're changing all these guidance, as they're responding to new contexts and don't have the training or necessarily the gear, that this may also be creating a lot of stress in our workforce. Fred Wilson made this comment really recently. He said, if you think of caseworkers as doctors and nurses, then we will recognize immediately that the sharp increase in demand will increase. So if we think of preventive services, for example, as hospital beds with respirators, we can imagine the demand outstripping the supply. This may leave workers with very hard decisions about how to respond, who gets services. If workers aren't comfortable, they probably will be, the burnout may indeed grow, worker retention rates may collapse, and the recruitment of new workers will dry up. Now, this is a bit of a dismal perspective. This is a possible perspective. So I want to keep these kinds of things in mind as we move into the take-home responses for this. So take-home number 2, good supervision is really critically important right now as our frontline workforce is under stress. We need to encourage them to make use of mental health as needed. And I've got some resources embedded in this. Plans now, insurance plans encouraging telehealth. So even though the workforce may be working from home and then responding, those kinds of services may be available. Our child welfare workforce may also be parenting and working from home. They may need some of the same resources we are providing to our families. We have to make sure that effective communication with law enforcement or EMS has happened if your state is one of those saying that you are going to respond with them, so that everybody has a plan for how this transpires in the most supportive and family-friendly approach as possible. We need quick collation and dissemination to frontline staff of accessible family and material support services. And many states are now working to obtain face masks and gloves. As we've heard on the TV, it's not necessary for these to be medical grade, but it is something we need to consider, not just for the CPS workers who may be nervous about going into a home, but also for the families who may be very nervous about a stranger coming to them that they don't know that might be. All of this will help us adjust the supply of what we need to manage the possible influx as reporting resurges. Okay. Brief break number 2.
Okay, we have some great questions coming in through the chat. I think I pivoted away too quickly the last time and didn't give people a chance to type. So Ashley is curious for any additional comment you can offer about the potential for a surge in reporting after the quarantine is over.
Sure. So even during the normal cycle of the summer dip, we see in August and September that this comes back up. So what people are talking about in terms of the surge is that when you think about reports going down like 70%, you can kind of have perhaps a mental image of a tsunami. Okay, so after an earthquake, what can happen is that you can actually see all the water receding back away from the coastline and exposing things, and then that is then followed by all that water coming back. So it isn't just a matter of thinking about, oh, well, this is increasing child maltreatment. It's a matter of thinking about the resurgence of reports that we would normally see that are now postponed till later.
Makes sense. Stephanie is curious what we know about the current situation as far as whether there really is in-person contact going on between children division workers and families. Is that something you're aware of, whether they're actually continuing to be able to investigate face-to-face?
So unfortunately, in a crisis, there's going to be some lag in data and information. I can tell you that we are one of the states that has that policy of trying to screen for COVID first before going in. I don't know yet how that's working for people in the field. And in most states, we do know that in-person visits are still happening. I just don't know how many of those are happening and under what guidance.
Okay, I'm going to give you one more, and then we'll continue, and then I'll make notes of the questions, and we'll make good use of everybody's time. Emily is wondering, as a mandated reporter, if there's anything that you can offer as far as what she should be doing to be supportive to Children's Division. Basically, any call to action that you have for all the mandated reporters out there in this particular moment.
Yeah, thank you. So a couple of things that are always true. The more information that you have when you report, the better. That helps the hotline make a good assessment. It helps people have the information they need when they go to see a family. If you are one of those services that may be a resource to that family afterwards, making sure that your information is up to date with Children's Division so that they know how you're doing business and with whom is very, very important. And just to know that it is still important to call those lines, even though the response may be a little different than we anticipated.
All right, let's continue the presentation, and I'll hit you with more questions in a bit.
Okay. Okay. So another thing that's happening across the country, and this is not just specific to child welfare, certainly, but it does have some interesting implications for child welfare, and that is the move of a lot of in-home type services going virtual. So the issues that we're seeing now raised across the country, first of all, is the social justice issue, the digital divide for families. This is something that was not foreseen, but is really bringing to the forefront how much access to information and technology is becoming a basic need, not something extra on the side. We don't know how this is going to impact both investigations and assessment and the ability to do effective case management. There is a lack of training in using distance case management techniques. Most of your colleagues in child welfare have not ever received training in crisis phone calls or telehealth or those kinds of services, so this is a very new territory for them as well. There's also some concern about developmental age of children and technology. You may well be able to have a phone call with an 11 or 12-year-old and ask them about how they're doing, but that's not going to work for a 2-year-old. The other concerns are spotty access to substance abuse or mental health services for parents trying to follow case plans. Many of those are also going to telehealth, but those also present problems for families that have difficulty connecting to those kinds of resources. And there's also some risk of anecdotal beliefs about child welfare that could impair responses, particularly post-social distance. So what is happening? What do we know? Not all regions are moving to remote case management. For example, New Mexico's really tried to move workers to thinking about how to do this in open spaces. That presents a whole nother slew of issues related possibly to confidentiality that we don't know what consequences there will be for that. I mentioned before, it's not clear when remote case management is happening, how that is impacting families who lack good technology. Some agencies seem to be thinking this is less of an issue for families they already have relationships with, but they're more concerned about the cases coming in now. And the pandemic itself, as well as the possible problems with families accessing not just child welfare case management, but supportive services, may cause us to see some increases in foster care, as well as increasing the time it takes for reunification. So take home number 3. We need to quickly set up best practices for remote case management if that is what your agency is doing, and other creative approaches to meeting needs. I'm not going to go through the resources. I've pulled some tele-intervention methods. Those will be on the slides for you if you want to look those up and see how they may be of assistance. There are resources now to help with temporary internet access, ways to leverage businesses for loaner computers. There's certainly a need to think about how to creatively use masks and gloves, not just for our child welfare workers, but families, participation. How we connect families to the telehealth, mental health, and substance use will be super important. And we may well have to extend court timelines for families with mandated services in the future, particularly when child safety is less of an issue, so that we are reunifying and keeping families together whenever possible. Okay. So child welfare's COVID response is sickening. So we all know chaotic times can lead to misinformation. We may feel that way a little bit sometimes when we listen to the news right now in general, and we know that bad news sometimes gets more press. So as we're making all these shifts in services and changes, we need to also be thinking about how this impacts bad press or how the public feels, but also how it may impact our ability to recover and serve families. So let's take an example. A recent quote in an article was, "First, most of the time, children are taken away not because they were beaten and tortured, but because of neglect, which just means the family was poor." Well, actually, that's not consistent with what we know about neglect, and it could well have implications for how people perceive possible increases in foster care later that may actually be detrimental to the families that we. I'm not going to read all this, but the take home number 4 is research and data are and will be really important. There's a significant body of research saying that child neglect is not the same as poverty. Most families struggling with material need do not become involved in neglecting behavior. Neglect does comprise the majority of reports of alleged maltreatment, so it is naturally, just by sheer numbers, going to comprise a large portion of foster care. But children may also come into contact with child welfare and even enter foster care for reasons not at all related to child maltreatment in times of crisis. Illness, death of caregivers. There are a lot of other reasons why this may happen. And I put this in bold because I realize I'm asking people to do something that's hard. In the middle of the crisis, we cannot back off of documenting need and responses, identifying changes in caseload that may have implications when reports resurge, and considering how timelines may have to be altered to preserve families while maintaining These need to be data-driven decisions. So, have a university partner handy. This might be a good time to bring them in to help. Okay. My pause number 3.
Okay, great. So we had a couple interesting comments and then additional questions coming in on the chat. We have to the question of whether or not child protective staff are having current face-to-face contact. We had just a few people check in about the work that they're currently doing.
Oh, good. Good.
Brian, who I remember when he was a Brown School student, he's in Massachusetts doing this work, and he's saying they're having minimal face-to-face contact at this point. It's really reserved for the most dire situations. Ashia mentioned that they're doing daily check-ins remotely with families. So those are just a couple of data points of what's going on out there. Some questions that we have. Courtney is wondering whether knowing that a family is in a hot spot, like a zip code where there's a lot of activity, does that change the approach right now? Change the approach.
So I'm assuming you mean a hotspot regarding the virus?
Exactly, a
Okay,
COVID-19 hotspot, sorry.
Yeah. No, it's okay. So we don't know. That's a really interesting question. I would suspect that if you are in New York City, the responses and the priorities will be different than they are in our region, where our infection rate, at least according to the percentage tested and the percentage positive, is relatively low. I don't know that for a fact because this information is all happening at once, and until we get more of a sense of feedback from what's going on in the field, it's really hard to say exactly what that's going to look like.
Great. And then Cynthia is wondering whether we have any data related to sort of urban, rural. Is the experience similar, or is that data not yet available?
That's a great question. Actually, we know very, very little about child protection and child welfare practice in rural areas in the best of times. This is largely because most of our large-scale studies that have been done that actually interview workers and families have purposively been designed so that they do not include rural areas because they're worried about the population numbers. Our national numbers that are available on an annual basis lump together all rural counties because they are afraid of how to report the numbers in those counties. So unfortunately, even before the crisis began, it would be very hard to answer that question well. We know that our rural areas often suffer from things like lack of public transportation, longer distance services. We do know that even before the crisis, healthcare was becoming an increasing problem with rural hospitals closing, et cetera. So I would imagine that those same kinds of resource constraints are impacting services, but most of what we're hearing from the COVID response and even in the articles has focused on urban areas. So even anecdotally, I don't know very much.
Okay, great. I'm going to give you 2 more and then we'll get back to it. So Michelle is, I think, just very practically wondering, at a time when systems and people are under so much stress, do you think it's wise to check in on all cases equally or approach more of a triage risk? If you only have so many hours in the day, what do you do?
Sure. No, I get that. So this is a tricky question that gets back to Fred Wilson's mention of people making difficult decisions. I kind of have 2 minds about this. One is that I suspect particularly new families will be perhaps even more so than normal dealing with day-to-day sort of bottom of Maslow's pyramid survival material needs kinds of issues. So I suspect there will be a significant need to triage right away those kinds of needs and get those families connected right away to the things that are going to alleviate their immediate needs. And that may well be something that in collaboration with other agencies can be shifted appropriately, quickly, and sort of decrease the amount of contact when a family is in that level of crisis in terms of the child welfare workers' time. I think people will naturally try to triage towards the more serious cases now. I think that happens anyway, to the extent that we are able to. One of the dilemmas we often have is knowing at one point when a case will truly have a later, more serious result. So particularly on the front end, when a family first comes to the attention of child welfare, our screening capacity, if there isn't serious injury or harm evident at that time, to determine who will then become later a serious crisis case is not as advanced as we would like. So we don't have nearly the empirical data we would like on how best to triage. I would say that this is a particularly important time to collaborate with your partners. So I think it's very, very important. Again, we talked about collating, disseminating to workers, like what's available in your community, what's open now. You know, what can I hand a family right now, even if I don't have time right now to spend 45 minutes with them? Probably the best we can do.
Okay, and then I'll give you one more question before getting back to the slideshow. Erin has mentioned that one of the things that's going on is that kids in foster care are losing in-person visits with their families of origin, and that can have negative impacts on the kids as well as their families. Do you have any suggestions for what can be done to mitigate those negative effects of what's necessary right now?
So one of the things that I knew I wasn't going to have a lot of time to go into is all the myriad of possible effects it's going to have on the foster care system in particular. But I do want to be responsive to the question. So I have, I guess, 3 comments. First is to acknowledge that with the family. I mean, I think it's really important to say this is hard. To let people acknowledge that this is a stressful situation, and then to work as creatively as possible. So in some states, they've suggested things like, well, maybe if the family can't meet in a closed environment, maybe there could be a social distancing walk in the park, you know, or reading a book to a child across, you know, the phone when there isn't a great way to have that discussion with that younger child. So I really think this is a time when we have to be as creative as possible to make those contacts happen, but still consider the safety regarding the virus transmission across, particularly since children don't tend to be symptomatic and have those responses. We may not know when they are safe to be in contact with other family members who may have elders in the home, those kinds of concerns. So I do think we have to be really creative. I do think, and there has been some comment on this, the other thing we need to consider is partnering with our family courts around our reunification timelines to relieve some of the stress on the families, to say that, you know, we understand it may be difficult to get some of the supports and resources that you need right now, to be as close as you want to be and to reunify in a timely manner, and work with our courts to think about extending those deadlines so that families and kids know that the intention is still strong to preserve families and reunify families, and that people are working out other means, that even though it's stressful now, it won't mean that the planned reunification won't happen, even if it happens a little bit.
All right, you want to get back to the slideshow?
Okay. So really, my final message is the pandemic is going to end, but our efforts should not. And I'm going to spend just a little bit of time talking about later. So we've talked about kind of now, what we know now, that some of the things that we need to do to be creative, to be supportive to both our child welfare workforce as well as our families, and think about how we can build a strong foundation going forward. But I do think it's also very important that we don't lose the lessons that we're learning now. One of the things that I found kind of sad, actually, as I was preparing this talk, was that after Hurricane Katrina, there were some articles coming out and a very nice disaster preparedness resource guide designed to help child welfare across the country develop disaster preparedness plans in advance that would allow people to not be receiving guidance 2 days into a crisis where everybody's kind of scrambling to know what to do, but to really say, oh, okay, so we have this disaster preparedness plan. We know that this unit is going to be deployed this way. We know that this will be a need in our community. So we know that we will have these pre-planned, designed systems that, of course, are going to be strained and may not work perfectly, but are much better than being in the middle of a crisis where everybody's trying to make things up from the ground up. So I really, one of the things I really, really urge everybody to think about is to push very, very hard, not to lose this thread. These reports came out in 2009, 21 years ago, and we are not seeing a plethora of well-planned disaster preparedness guidelines across this country, and it's really important that we think about these things in advance. Not because I want another pandemic to happen, but because these are also useful when we have natural disasters. The wildfires in Australia and California, all those kinds of things are we much more responsive to family needs, much better off in terms of child outcomes if we have a plan. Secondly, we used to have a faculty member years ago here who actually studied the positive aftermath of when bad things happen. And I'm not diminishing the horror and the fear of what's going on right now, but we may actually learn some new best practices from this as well that we need to think about. So while things may not all go well, we may innovate some approaches that make sense and are more helpful. Somebody mentioned making more frequent check-in calls. So there has been this tradition of having some monthly visits, and certainly that may make sense, but it also may be more useful in some cases to have brief little check-in calls along the way, and it may be something that we want to preserve. We need to think about effective deployment and use of technology. Somebody brought up rural areas. Rural telehealth is one of the recommendations for mental health. There may be ways in which we want to think about the use of technology in child welfare in rural areas as well. There may well be increased willingness to link agency data systems. So for example, if I knew I was linked to the regional sources in my area, if I was about to go out on a call for a family, I perhaps could check into some sort of portal where I knew that this shelter had availability, or the substance abuse or telehealth over at this clinic was now open, and I would be much more prepared to be helpful immediately to that family when I went out. So I think we need to think about that. We need to improve our understanding of the delivery and the amount and kinds of economic supports that prevent child abuse. That's a whole nother talk. So I'm not going to go into detail, but we do have emerging evidence even a little bit of assistance in many cases can go a long way. We have not developed this area enough to make solid policy recommendations to our legislatures and to our businesses about what this would look like. And Fred Wilson mentions as well that this needs to be an avenue in the future. So as we're doing this now, we need to think about the positive benefits and spillover for child abuse and neglect. I think we should be ready to take advantage of funding flexibility, even some possible increases in funding for post-COVID response. So I think the more that we are going back to talking about documenting the needs and resources and responses carefully that are happening now, the more ready we will be to think about how we innovate, how we request more staff, how we prepare to develop and implement training. If we need to bring on number of new child welfare staff to be ready for the post-COVID response, how are we going to do that? Who's going to train them? How is that going to happen? We need to be thinking about ways to move forward, and recover is a good word, but I would like to think that we can also improve, not just restore the system. And so I'm hopeful that in the midst of this, there will be some lessons learned that we can carry forward that will really further our ability to support families and have positive outcomes for kids across the country. So, you know, a little bit lighthearted and sort of a not lighthearted subject. I know it seems like a lot. We've covered a lot of ground. We're thinking about everything from kids perhaps being less safe because people don't have eyes on them, about system responses and what's going to happen post-COVID, even as we are excited and looking forward to not being socially distant and seeing each other and going back to school and those kinds of things. That there are important post-COVID responses necessary that we need to prepare for so that we are not caught off guard and we can respond to those needs as they appear, not because they're new needs, but because they're needs that have gone unmet while we have been distant. And then I think we also need to really be mindful and supportive of each other during these times. There's a lot of discussion about, forgiveness for doing the best that you can. I think it's very important. I know probably most, if not all of you, are child and family serving kind of people. Take time to say this to yourselves and colleagues and partners frequently and often. And reach out to your university partners. We don't always have data this fast in these chaotic times, but we can be useful in terms of finding information and getting that out and being available. So available the rest of the time for questions, willing to go off-road to things that I was worried about including and not maybe having time for.
Great. We've got some wonderful comments and questions that have come in through the chat. Steph, appreciate your animal memes, so I just thought I would share that with you. But a couple of things around disaster preparedness, planning. Dessa offered, I thought, a really insightful comment that in situations like this, plans being in place and disseminated to foster families proactively are really important, and that may be an opportunity for us to learn and improve. Danielle is curious whether you're optimistic that this moment is going to help us invest more in preparedness and be more prepared next time. So that's kind of yeah, sorry, just again.
I mean, the short answer is I certainly hope so. I mean, we have some of the foundational work from before. We can update with what we've learned. This there are now 3 child maltreatment national centers as well as the camp centers. There are some increased partnerships and availability wonderful people like Janet who help with professional development, and a lot of people thinking more about dissemination and collaboration between agencies. So I am hopeful that both the level of awareness that this is raised and the national level. So this isn't a storm that happened in one state. This is a storm that happened across the entire nation. So it's very different in that way. So I'm cautiously optimistic that we will learn from this and that we will work very hard to make sure that in times of coming crisis that we have a better system.
So Theta is wanting to know about whether the slides are going to be emailed, and we're going to be furnishing everyone who registered with a link to Melissa's center's website where these slides, along with other resources that may be helpful to you, are posted. So yes, you will have access to this information to review and share. An interesting question we had from Kate. She was mentioning that some school districts are being encouraged to report families for educational neglect if the child is not logging on and participating in their online school. She's wondering a couple of things. One is, what other options or suggestions are available short of reporting people for educational neglect? She's also curious if you know what happens if that report is made at this moment.
So a couple of thoughts. First of all, not knowing why that is happening, I would be hesitant to call that a reportable event. It could be a technology event. It could be a family that's overwhelmed during illness. My first inclination would be to try to make other kinds of contact with the family and see if there are other reasons why they're just simply too overwhelmed right now to participate or just don't know how. Secondly, even in non-crisis times, educational neglect reports are not a priority for most child welfare agencies. In some cases, they're triaged out. In some states, educational neglect is not reportable at all. So it will vary depending on where you are, what kind of response, but I would guess that if that is the only concern right now, that would not be a huge service priority. So I would be looking to my other partners in the community, thinking about if there are other ways to get in touch with those families, and really doing everything possible outside of that, because I'm not sure even if you were to move in that way that there would be much.
So Kate did just clarify that the calls are being made after attempts at outreach, and it is at least in part coming from wanting to know that the children are okay.
Sure. No, I really understand that. I'm just, in the case when so many of these agencies are triaging out cases, I'm not sure that they would have much ability to provide help. I do know that most of our hotlines across the country are always willing to chat with people and sort of problem solve, even if this is a case where they're not going to screen it in. Sometimes they can give advice or resources. So I would look to, if you have an agency that you typically collaborate, perhaps they provide family services and they have another inroad to that family. That might be a better avenue right now, perhaps, to reach out. It's a really tough situation. I wish I had better advice, but I am concerned that I'm just not sure child welfare is going to be able to respond.
Okay, we had a question from Brandon, and his interest is international. We've been primarily talking about this in a U.S. context. So I don't know if there's any international data available. He was curious about basically anything you knew about risk factors and data, most specifically on the global south.
So there is one, I did embed one resource in supportive family that is more internationally focused. There are similar concerns from places like Australia, Canada, that have kind of similar systems to ours. And so the risk factors in countries that are sort of the first world countries to coin a phrase, are going to be similar to ours. In developing nations, most of our understanding of child protection actually comes from humanitarian situations. There are some resources from UNICEF, from the World Health Organization, and I'm blanking on the name of the organization, and violence, but it's in one of the slides. The globally, the stressors that relate to maltreatment, there are just some commonalities. When families are under enormous economic stress, enormous mental health stress, having health problems, having access to resources, those are things that are pretty consistent across countries. And globally, there's such a huge difference in how child protection is managed. So in some cases, through NGOs, in some cases, it's governmental. In some cases, it's fairly non-existent still, so it's a little difficult for me to respond in an intelligent way. We are in infancy in terms of our sharing of data and research on child maltreatment and child welfare globally. I will also say that is an area of great need. That we know child maltreatment is a global problem. We know that families need support all across the world, but how this is done and where it's most effective and how this is happening on the ground, the data just are very scarce.
So we have time for one last question, and I saved this one for last because I do think it's important and possibly a good way to send people out. Ashley was wondering about the mandated reporting process, and I imagine that may vary with jurisdiction, but everyone on this webinar cares deeply about the well-being of children. What would you like to leave them with about what they should do if they suspect maltreatment?
So in the slides, I have embedded actually the national line. So there is a national parenting hotline that you can call because it was not possible for me to gather all the numbers from all the different states. So all states will have their own number. But if that's hard to find, you can call the national parenting hotline, and they are staffed 24/7. They respond to not just child maltreatment calls, but actually calls for parenting help as well. And they are happy to talk through the process if you have not reported before, and what's most appropriate. And then they can also send you to your regional or state level number that you call. When you make a call, it is very important for you to have as much information as possible. And this sort of makes sense. So if I were to call and I said, well, I'm concerned about a child that's wearing a green shirt that I just saw in the park when I was walking my dog, that's going to be super hard for an agency to respond to. On the other hand, if I can give someone an address, an idea of what my specific concerns are, the person that takes that call has the responsibility to say, here is the information I'm hearing. Here are our state guidelines. Is this information matching with our state guidelines so that we will respond? Okay, so there are things that are a little bit different from region to region, what's reportable or not. So having that information being very clear, and having enough information to locate the family is very important. If you are a clinician and working with a family, thinking about reporting them, there are some best practices out there in terms of making that report with a family, and with their understanding and talking them through the process so that you don't lose that clinical connection with them. That is also why it's very important that as you work with families, if you are a mandated reporter, that you cover that up front, so that they understand what your role is in protecting children, but also in seeking. It's also important to keep in mind that while we are very focused on foster care, very, very few cases go into foster care after report. So all efforts really are on how do we support families and how do we try to balance that child's safety with keeping families together and making sure they have the resources.
Okay, it is 1:30, and I think that's a great place to leave us. So I will sign off by reminding everyone that this is a continuing series, and that on Tuesday of next week, same time, 12:30 Central, we're going to be joined by Dr. Kim Johnson, who's going to be providing a talk on Epidemiology 101, using examples both of COVID-19, but other things that epidemiologists understand that I do not. I also want to mention that just because of how successful we've been reaching out to people and the need that this seems to be filling to connect with community, we have extended the series. So if you were responding to some of our first outreach, we had the series ending at the end of April, and we are now booking past the 3rd week of May. So if you haven't visited the website to see what's coming, I certainly invite you back to check out those offerings. And with that, we wish everyone well, safe, you and your loved ones. These are challenging times, and you are doing amazing work, and we're proud to have you as part of our family. Stay safe, everybody.